Thank you for inviting us onto the call today to talk about the Evidence for Quality Improvement randomised coffee trial. My name is Andrea Gibbons and I'm the lead for the Evidence for Quality Improvement project, and I'm based in Somerset NHS Foundation Trust. Before we talk about the randomised coffee trial, let me just tell you a little bit about the Evidence for Quality Improvement project. Evidence for QI, or E for QI, is a national project that aims to support the QI community to better use evidence in improvement projects. It won funding from the Health Foundation and NHS England and Improvements through the Q Exchange at the end of 2019. The project was created to tackle a problem. What was that problem? It was that QI teams do not routinely find, use or share evidence in quality improvement projects. As a result, we repeat mistakes, work less efficiently, make uninformed decisions and reinvent the wheel. And just to make it clear, I am a QI advisor and member of the QI team, so I'm talking about myself. How are we trying to achieve our aim? Well, we're trying to do this in three main ways. Firstly, empowering and equipping the library and knowledge services teams across our community to support the evidence needs of QI. Secondly, we're trying to create an appetite in the QI community for using and sharing knowledge, evidence and best practice. Thirdly, we're trying to make connections, build relationships and create a community committed to sharing knowledge. So moving on to the randomised coffee trial, what is a randomised coffee trial and why did we run one? A randomised coffee trial, as you're, I'm sure, aware, is simply a way of connecting people. What was different about our coffee trial is that we wanted to break down organisational silos and disciplinary silos. We believed that the coffee trial would be a great way for anyone interested in using evidence for QI to build their networks, share their experience and ideas, and finally connect and collaborate. So how did we do it? Well, first of all, we assembled a steering group of library and knowledge services and quality improvement people, of which Victoria and Leeanne with me are members of that team. Together, we agreed a process, we assigned roles and we distributed tasks. We worked on MS Teams and we shared all of our knowledge, experience and resources from previous experience. We recruited people onto the coffee trial using Twitter and emails, although there's more that we could have done on that. And in total, 122 people signed up by the deadline. These were a mix of QI and library and knowledge services people, as well as some people with lived experience and people from outside the UK and Ireland as well. So we had people as far away as Australia taking part in the event. The randomised coffee trial closed this Monday and we sent out a feedback survey immediately afterwards. So far, of the 122 people who took part in the randomised coffee trial, 72 have replied and shared their feedback with us, which has been very positive, very encouraging, and given us some thoughts and tips on where to focus when we next run it, again in January 2021. During the randomised coffee trial, we also encouraged participants to tweet, and we also ran a competition to create a strapline to help us promote the next round of the randomised coffee trial in January 2021. I'm now going to pass over to my colleagues to continue the story of the randomised coffee trial. Thank you.
Thank you, Andrea. Hi everyone, I'm Victoria. I work as a knowledge manager in NHS England and NHS Improvements, and I'm also part of the Evidence4QI network. We thought it would be helpful to share with you some of our top tips for hosting a randomised coffee trial and some of the things that we've learned, particularly running this as a cross-organisational project and working with people in different networks, different communities and outside our own usual organisational networks. So firstly, one of the things we learned was the importance of relationships and having the right people involved on the steering group from the start, so that essentially the coffee trial became a co-produced process. We made sure that that invite was open so that everybody in the steering group felt welcome and able to contribute. The randomised coffee trial itself was open to everybody who had an interest in using Evidence4QI. So it was very broad. The invitation was extended to anybody with that interest. And that meant we had some really wide-ranging pairs as well when it came to matching people up, including people with lived experience who we may not have reached otherwise. Secondly, make sure that there's good leadership to your project. So Andrea headed up our efforts and was pivotal in nurturing this collaborative approach. And she coordinated and encouraged everybody in the steering group to take part, but also give us space not to if we felt that that was right for us. And it's ended up being very much our project and not just hers. And I know that's important to her and all of us so that the project's sustainable. Thirdly, use your network. So we wanted to find the right people so that we could share meaningfully, and we tapped into both library and QI networks, mainly across Twitter, to share the message and recruit people, and that undoubtedly helped us to recruit the great number of people that we did in the end. Fourth point, so using people's skill sets optimally, and we knew that on the steering group we had people with tons of experience who had also run local randomised coffee trials in their own organisations, so we harnessed the skills that we had in the group. We discovered that one of the group had particular expertise in using Excel, so that was particularly helpful when it came to matching people together as pairs. I'm going to hand over to Leeanne now, who's going to run through the rest of our top tips.
Thanks, Victoria. Thanks, Andrea. And thank you for inviting me to your webinar. So my name's Leeanne, and professionally I work with the Renal Association, building QI capability and QI leadership. And personally, I'm also proud to say that I'm an ambassador for the Academy of Fabulous Staff. So number 5, no, sorry. So yes, so using the right tools. What we did was we made sure that there were people in the steering group who had already done a randomised coffee trial. So we shared our examples of good practice, and we kept them all in one place. And we had lots of email templates and visual templates. We have a motto, don't reinvent the wheel, pinch with pride, and that was very much the theme that we had with our tools. Just make sure that they're all in one place, and we had a really good repository. Use social media to your advantage. Twitter really took off, and it allowed us to reach beyond sort of those organisational boundaries. We had people from America, Canada, Australia joining us, which was absolutely unprecedented for us. And we encouraged people to share on social media, mainly Twitter, to create that strap line that's been mentioned before, and learn from each other. It's really, really key. You know, we learned from our local initiatives, and we made a new group out of contact as a result. So me personally, my network has grown bigger, just being involved in this project. And I think lastly, the most important thing is have fun, especially in these really difficult times. You know, we all came. It was nice to talk about something that wasn't COVID related. We all came and we were all nice and relaxed, and we just had fun, you know, and we were sharing really funny stories with each other, and it just helped to build that human connection and build those relationships. So I think that's our time up. So thank you very much for your time. Please get in touch with us if you want any more information. We're more than happy to share any of our tools with you. We're also happy to take any questions or comments just now.